Brendan O'Neill, I'm not surprised one jot about this poll. It's not something that we're allowed to discuss, is it? Because we have to praise the glorious NHS at every single moment of the day. But the glorious NHS sent me a text message this week saying, don't go to the GP. We're shut. We can't see you for any form of appointment. And people all over the country, Brendan, are getting text messages like that on a constant basis.
Absolutely. And I wasn't surprised by these surveys at all, actually. And it's not surprising that they came after the lockdown period, because this was, as you say, this was when it became the national COVID service, when we basically stopped treating anything except COVID-19. And lots of people got sick as a result. Cancer went untreated or undetected. Heart disease potentially got worse too. We know there's been a surge in mental health problems. So I think what's happened is, because the NHS was pretty much closed down in some ways during the pandemic and during the lockdowns in particular, we've stored up a lot of health problems. People couldn't get to see GPs, and they were incredibly frustrated with this health service that we are told is the envy of the world. So I'm not surprised people are losing faith in the NHS.
No, and they're losing faith, Brendan, at a time when we pump more and more money in. It's not working, is it?
It's not working, and I'm in favour of universal healthcare. I'm in favour of free healthcare. I think it's a good idea, but it's not working. It's not really doing what it's supposed to do. And actually, it proves a theory I've had for a long time, which is that the problem with the NHS is not a lack of funding. It gets loads and loads of money every year. The problem is that it doesn't really know what it's for anymore. So not only did it basically shut itself down during the COVID pandemic, but also it's become an institution that wants to tell us how to live and how to think, as much as treat us when we're ill. So, it's become incredibly politically correct. We've heard about men now being asked if they're pregnant. There is a whole new layer of managerial officers and diversity officers who get paid an extraordinary amount of money, essentially to politicize the NHS. And all of those things mean that the health service has lost its way. And it often feels to people like a hectoring institution, rather than an institution that simply mends us when we're not well. And that's what it needs to focus on now.